Thank you for having time to listen to the perspective of the trans community in regards to HIV and prevention programs. We have in Amsterdam a very interesting concept, and we see it in more countries in Europe where our community people lead important initiatives that actually enhance either hormone replacement therapy and HIV prevention programs for the most marginalized. So those are the trans people who migrate, trans people who are living under the poverty line, who have no access to healthcare. And for them, it's very important, of course, to get into the care system. What is interesting from that perspective is that we see that in the beginning it was quite difficult to navigate how we could operate within the structures that were existing. So that would be like testing centers, hospitals, etc. But as people saw that it's very difficult to reach the most marginalized people because they have specific stigmas and also lots of discrimination, but also sometimes fear for institutions because of their, it could be their status, like their visa, or actually sometimes even undocumented. So for them, it is very difficult to access healthcare for various reasons. And also they sort of fear sometimes for uniforms and people who occupy spaces that do in the country where they come from sometimes have different, like memories on people who work in that sector. So there's some sort of like, we saw the people and with empowerment meetings. And at a certain moment, we started to talk with policymakers of municipalities, people in politics, that it's so important for our community to at least have access to good healthcare. And we as well acknowledge that we are the people who are actually most at risk when it comes to HIV infections, due to the fact that we do sometimes survival sex, or it's our occupation. So that is also where, again, another of that keep-ups are coming together. So you have trans people who do sex work, or survival sex work. And that is an important part of actually where we would like to see people, of course, tested, but also on medication when it's needed. And I think we saw together with our colleagues in Paris, that is from Acceptes, that group is primarily also doing the same kind of work that we do here in Amsterdam, and we found people in Barcelona who do the same. And we combined our knowledge of how to reach out to the community by providing them, for example, with food information about legal systems in cities, or how they could get sometimes benefits. We collect food for them, or clothes, and there is always something where they would like to come, and as well because they find their own peers. And for us to be transparent and possibly talking about HIV as trans people who live with HIV, it is really important that we sort of like build that safe space where people understand that they will not be evicted when they speak with us, or that there will be other, institutions such as the police sometimes, where they're afraid of. At the moment that we sort of like seek contact either with hospitals or with municipality health services, we saw that we could work together. For example, have the people of the service inside our safe space to get in contact with people, possible prospect patients. And as well, when people with crisis interventions are coming in, and we detect it as something that could be related to HIV, we immediately have the connection to bring those people into the care system. Actually, in an hour, we could arrange something. And I think that is majorly important, that we break through all those stigmas that we know that are existing, like it's in the trans community about transphobia, it is about poverty, there is a stigma about being, for example, a migrant of color, in a society that is not welcoming there are all these kind of things. And also the family system can be sometimes very hostile. And we sort of build a family together in our trans community where people of different backgrounds come together from the trans community and find their friends, sisters, mothers, fathers sometimes. And it's really important that together, those people who are sort of like leaders in those community find access to existing HIV prevention and care structures. And how we at the moment are seeing the involvement, of course, of civil society, social enablers to the discussion of how to really go to the point where we would like to reach, of course, like 0 new infections. It's really important to find programs for people that are really people-centered. They should be sort of like inserted in existing programs or innovative programs together with community. And in that sense, it's possible to reach populations that we actually all need to find. And it's good if we do that from the peer perspective. So when you have trans people living with HIV, they could be sort of like the person's guiding, they could set up a program. It's important to find those organizations, community leaders, and people who are actually mostly organizing at the margins. You will not find those people immediately at the large groups or the communities that stand for trans organizations or human rights in your respective countries, because mainly in those policy or advocacy groups for the trans community, they don't really have a focus on HIV or STIs, and also not sometimes even on sex work or on intersectional issues. And I think for us, it's really important as people who are at the forefront to understand that this task of stigmatization within the trans community, it's important to talk about that it is an existing issue. It's not only for trans people who, for example, have different lives, live on the streets or have unsafe sex, or have other sexual activities that are sometimes for money. It is something that is really important to know for the community, that it's for all of the people in the trans community. There is a vulnerability and an extra possibility to become HIV infected. And there are many factors, but the communication within the community needs to start at the community level. And it all has to do with a lot of stigma and transphobia internalized as well. But that is something from the community. So I think it's always good to know when you speak with people who are living with HIV and are trans, that they have access to communities and people easier than people who are, for example, trans, but have no real link with HIV or the stigma related. It's important for me to tell about the best practice, I would say, for you. That's what we have functioning here in Amsterdam. We are part of the H team, which is a prevention program with existing stakeholders such as the medical hospitals, but also individual, like AIDS funds, for example, is part. And we come together, we bring perspectives in, and we run programs. So, for example, there's the PrEP program that is also running in the trans community, in our trans clinic. The trans clinic is organized by the trans community, by the BIPOC trans community, so the migrant, Black and people of color trans community. But it's also directly in collaboration with the doctors of the municipality health services from the STI and HIV prevention program. And why is it important? Because those doctors, they see people for those important, medical exercises on HIV and STI, but also they can provide hormones. So the people actually who are normally not daring to come to hospitals because they are, for example, undocumented, or they think they took medication or made operations that make them sort of vulnerable in the medical system, which is mainly cis heterosexual. So for people who are born in the gender identity that they were born with and they feel comfortable with it. That's a cis person. So for cis persons, it is pretty excessive, but for the trans community, it's really difficult in that sense. The most important thing is that we brought people together with knowledge, experience, and as well in possibilities to get in really marginalized communities, bring it together at a specific hour or a day, and then people can come for hormone checkups and also receive all the possible treatments for HIV and prevention. And this is very novelty. I would say, like, not a lot of municipality doctors would immediately think that it's possible to also prescribe hormones. But for example, if you have sexuologists in your team, you have an internal doctor, it is possible. And then you can actually provide some service to people who in general would be like, it's also sort of harm reduction, because people take medication on their own, a lot of things that they don't know what it is. And as soon as we can do the blood work, it is really possible to follow together with the patient. It's like really the informed consent from the ICD-11 that we use, but it is something that is important to tell, because it is possible to reach to the most marginalized and visibilized communities that actually are at great risk with some innovative projects, people who dare to think outside of the box and who are able to provide those services. I think that would be, for me, sort of like the most important to tell, because from the community perspective, it is known that trans people need hormones. They are as well in vulnerable situations on HIV. And if we have doctors who can provide a service together in combination, where people can find either hormones and their checkups, and where we can get people into care when it's needed after a positive HIV test. That is where I see for our community the most and the fastest way to change the negative narrative, of course, about trans people in HIV. Recently, we found in Maastricht, actually, that's just out, Maastricht University, a research on trans people. So I would find a grasp on it if it's possible for you. It's also in English available, and it finds out that we have a very high prevalence and possibility to get HIV, but it's also proven within that specific academic research that it is also trans men who are at stake. So it's actually the whole trans community. And then, of course, the most marginalized and the most vulnerable are people who are facing multiple intersectional possible exclusion mechanisms. And that can be due to their skin color, can be due to their, sometimes we have a lot of trans people with a Syrian or an Arabic background. They find also issues in the specific hospitals and centers. So it is for us important that we as communities of migrating people living with HIV have the possibility to work together with clinicians and hospitals. Thank you for your time. This would be my short, brief insight in the trans community and in the work that we do at Trans United Europe. Thank you.